All right, Paul. Another conundrum is this distal DVT. How do you handle those?
I hate them so much, man. In case you can't get the vibe,
No, why does that not surprise me?
because I hate uncertainty, and the scenario that I typically see is you have someone who comes in with concern for DVT, like they have a little bit of calf fullness, and you feel like you see some asymmetry on examination. There's enough risk factors, so you send them for the venous duplex study, and it comes back with just a distal DVT. So the reason I struggle with this is because there are different ways to kind of handle it. So in isolated distal DVT, I think you even have the option of monitoring with serial ultrasounds in some circumstances. But when you read a lot of guidelines would advocate treating someone for symptomatic DVT that is distal, and my argument is always I wouldn't be looking for it if they weren't symptomatic. And like that's where I kind of struggle with. So I feel like most of the time I will end up treating these patients by they've defined themselves, but there are theoretically other avenues you could pursue, even though I don't feel great about any of them in particular. Do you have a different algorithm, or do you just agonize less over this particular thing, Matt?
No, I don't have a different algorithm. I think I've had one person that like just sort of insisted on not being treated, and we followed with ultrasounds, and it was hard because it was like they were supposed to get ultrasound weekly for a couple weeks, and they ended up getting like 1, 2, or 3 weeks later, and
Yeah.
fortunately it hadn't like extended a ton, but it was kind of a mess. So I think the easier thing, if the patient's willing, is to just treat them. And because I mean, if they were symptomatic, who knows, maybe they had like a small piece break off and it was bigger,
Yeah.
before you saw it. I don't know. But that's kind of my thinking. Another area of uncertainty I had was because when you look up on like a lexicomp or something like that, they used to have these, oh, for patients above BMI of 40 or 35, be really careful, and like almost all the patients in the hospital have BMI over 35, and then or very at extremes of weight, basically very low BMI, very high BMI, be careful. She told us that as long as the person's not more than 150 kg, that for the most part, it seems like there's a very wide therapeutic index for these agents, and that patients are okay even if they're BMI over 40, as long So that's useful. She said the one group she does worry about is the post bariatric surgery because absorption can be different. So in those cases, you might want to monitor 10A levels, which is something that I have not been trained to do, Paul. So I would probably be consulting with a hematologist or a pharmacist like her for that.
Yep. Same.
Yeah. What about this treatment failure? I don't really, again, this might be one of those ones where the answer is refer. Actually, I know that's going to be the answer, Paul, talking with you. But in general, any advice for the audience or anything you remember about that from the conversation that you wanted to pass on?
No, I mean, my general practice, Matt. I feel like if I'm asking a question I'm not sure the answer to, that's what specialists exist for. So it would, if someone had a treatment failure under medication, and particularly a DOAC, I would probably send to hematology because I just don't have comfort with the labs and the things to kind of chase down necessarily.
But the main thing she told us is like, try to really press them, like, how were you taking it? Did you miss any doses? Has anything else changed? Any new medications? Something that could explain like why it happened. Was it really a treatment failure, or was it like a just an extenuating circumstance of some kind?
Yep.
So let's see what else, Paul. I mean, I think we've gone through a lot of this stuff. There was a lot more on this episode, but I really recommend people listen to the full thing if they haven't heard it, because there's just so many different like nuanced things we asked her about, and it's hard to recap those in this format.